Hi, friends. It's such a pleasure to talk to you this afternoon from Mumbai. I'm Dr. Niranjan Banka, Chief Hepatogastroenterologist at Bombay Hospital Institute of Medical Sciences. I thought it's an important topic in today's time, uh, the functional GI disorders. There's so much research has occurred in this, so much to know about. In vast population, majority of patients fall into this category of functional GI disorders. What are these functional GI disorders? These are the disorders which are widespread throughout the world. The two most common functional GI disorders encountered in our practice are functional dyspepsia and irritable bowel syndrome. The functional GI disorders are clinical syndromes characterized by chronic or recurring abdominal symptoms with no identifiable cause using standard diagnostic measures. In the general population, functional abdominal symptoms are prevalent to a large extent. Many people do not seek medical attention, but the severity of symptoms may be one factor that encourages them to go to the hospital or to the doctor. Symptoms of functional dyspepsia and irritable bowel syndrome are frequently associated with meals and can include abdominal pain, bloating, early satiety, fullness, belching, and nausea. Impaired meal-induced proximal stomach relaxation, visceral hypersensitivity to distension, gastric motor abnormalities, and disrupted central nervous function have been implicated as critical pathophysiological mechanisms causing dyspeptic symptoms, but the overlap between them is very common. In rural Indian populations, functional GI disorders, particularly dyspepsia IBS overlap, are common. A door-to-door survey in rural India found a prevalence of about 21.7% for functional GI disorders, including dyspepsia, IBS, and dyspepsia IBS overlap as defined by Rome 3 criteria. Chewing tobacco, aerated soft drinks, consumption of tea and coffee, disturbed sleep, and anxiety parameters are well linked to functional GI disorders in a multivariate analysis. The recent updated Rome 4 criteria were developed not only to provide guidance for research studies in journal and therapeutic trials in particular, but also to facilitate making a positive diagnosis of individual functional GI disorders based on the presence of characteristic symptoms as well as the absence of alarm features and objective findings from a limited number of standard diagnostics tests and investigations. The ROM 4 criteria define dyspepsia as any combination of four symptoms. They could be functional postprandial fullness, early satiety, epigastric pain, and epigastric burning that are severe enough to interfere with daily activities and occur at least 3 days per week for the previous 3 months, with an onset at least 6 months in advance. IBS is a syndrome defined by recurrent abdominal pain in conjunction with altered bowel habits such as diarrhea, constipation, or both. According to the Rome 4 criteria, symptom onset should be at least 6 months before diagnosis, and symptoms should be present within the last 3 months. Functional GI symptoms may be caused by a genetic predisposition, early life events, stress, allergy, atopic disposition, dysbiosis, including current and previous infection, and brain gut or gut brain axis dysfunction. Although specific pathophysiological changes in the stomach, duodenum, and colon are now being identified as possible source of symptoms in functional dyspepsia and IBS, it is becoming clear that a comprehensive approach to treating these disorders is also required. Successful therapy for patients with functional dyspepsia and irritable bowel syndrome is currently based on the careful exclusion of organic disease with the treatment provided as needed. All patients require advice on simple measures, the lifestyles such as reassurance and dietary and lifestyle changes, followed by symptom management with evidence-based drugs as needed. Digestive enzymes have shown statistically significant improvement in stool frequency, consistency of the stools, and reduction of abdominal pain in patients with irritable bowel syndrome. Digestive enzyme supplementation in functional dyspepsia significantly reduced the symptoms of flatulence, bloating, belching, fullness, and postprandial distress in the clinical trials. Friends, in short, I have given you the bird's eye view of the functional GI disorder and maybe look into the management using the GI enzymes, the digestive enzymes, which can probably substantially reduce the symptoms. It was a pleasure talking to you. Have a great evening. Thank you very much.